Welcome back to day 3 of our 30-day challenge in honor of World Sickle Cell Day, June 19th. Yesterday we talked about the 3 different types of cells inside your bloodstream. Today we're going to talk about the most important one here in this world of sickle cell. Drum roll please. Your red blood cell. If you were expecting something high-tech, we're pretty low-tech here at Hope, keeping it simple with a cardboard blood cell. And we're going to talk about the characteristics first and then exactly what it does. So you'll notice that this red blood cell, which mirrors your actual red blood cells inside your body, has some important characteristics. First of all, it is round in shape. It's often called a donut with the hole filled in. And most importantly, it is squishy. So I can manipulate it to get it into different places. I can squish it up real small, open it up, twist, turn. Does all kinds of those things. Your actual red blood cell does that as well. So we're going to demonstrate how that helps you inside your blood vessels. So I have some props here. I want to preface that none of these are to scale. They're just to show you how your red blood cells work. So our first prop here is this tube, which is going to represent the biggest blood vessels in your body, your arteries. So you can think of one that you have here along your neck. So your red blood cell easily fits into the artery. Didn't have to do hardly any squishing to travel through that. But you have different sized blood vessels, so we're going to go with the next smaller size, and that would be something like a vein. So see how this end is a little bit smaller, and your red blood cell had to do just a little bit of sticking in there, squishing to get inside, but it still fits easily. But what about those really small blood vessels we talked about yesterday called your capillaries? Can your red blood cells fit all the way in there easily? Well, the answer is yes, because one of the things that they can do easily is do that squishing down. So give me a second here while I squish this blood vessel on down. And your body is much faster and more efficient at doing this than I am, because it does it all day, every day. And now let's see, does this red blood cell fit? It does, and now it fits inside this teeny tiny capillary. So, in addition to being squishy and twisty and moldy, it also has really vitally important job. The main job of your red blood cells are to be the transporters within your bloodstream. So they pick up the oxygen in your lungs and they take it to all the different tissues throughout your body. So without oxygen, the tissues in your body, and that's everything that's living, and the reason I say living is it doesn't include your hair and your fingernails because those parts of your body actually aren't living, but all the tissues that are living, your skin cells, your organs, everything in that, your bones, all of those things require oxygen to keep going. So if they lose oxygen, they become damaged and eventually they will die. Let's think of this similar to frostbite when you're in a winter storm. The reason you get frostbite is the oxygen doesn't travel all the way to the end efficiently, and after time, eventually you see people who have frostbite on the tips of their fingers and the tissue there actually dies. So those red blood cells are vitally important to the life of the tissues inside your body. And remember, we talked about the passengers inside this red blood cell are called hemoglobin, which is a word we use very frequently in sickle cell. The hemoglobin are the passengers that carry the oxygen as that red blood cell car is traveling through your blood vessels. So after it drops off that oxygen at the tissue trades off and gives it the waste that it no longer needs called carbon dioxide. We don't need this, and we actually have to have it leave our body or we can have damage. So the red blood cell drops off the oxygen and then picks up the carbon dioxide, and it travels back up out to the lungs, and that's what you are exhaling is that carbon dioxide. Breathing in oxygen, exhaling carbon dioxide. So that is the role of your red blood cell within your body. Stay tuned tomorrow when we start a little mini-series competition between your healthy red blood cells and sickle cells. Check us out on the web at hopeforscd.org. Sign up for our newsletter and spread the word about our video challenge and post any comments or questions you have below. Thanks and stay tuned.